In a world where the journey to parenthood can take unexpected turns, advancements in science have given new possibilities and hope to countless families. Hello everybody, you're watching Women Talk with me, Nadia, Azmi, and today's topic is a very special one. It's a topic that has touched the hearts of many aspiring parents worldwide and in Malaysia as well. What are we going to talk about today? It is about in vitro fertilization or IVF. You may or may not be familiar with IVF, but that's why you need to watch today's episode to know more about it. And I think it's important to note that infertility has affected many families, many couples around the world and in our country as well. But we're privileged to have technology advancements, innovation, and also the experts who are at the forefront to help give these couples with these challenges hope and light. So with us today in the studio, I'd like to introduce our guests. We have Dr. Haris Hamzah on my left. He is a consultant obstetrician and a gynecologist and also a leading fertility specialist from Al Hayah Fertility Center, who's here to share his expertise and shed light on the latest in reproductive medicine. And it's also important to note, he is not just any doctor. Yes, Dr. Haris. Dr. Haris is the first doctor in Malaysia to do IVF treatment with successful birth. We are so privileged to have him here today at Women Talk. And also joining him on his left is Tiffany T. Hi, Tiffany, who is a chief embryologist. I hope I got that correct, the pronunciation, whose expertise covers various fertility techniques and dedicated to advancing assisted reproduction. So today we'll unpack more about what IVF really is, what is it, what are the challenges that couples will need to go through, and how successful can IVF be. So Dr. Haris, my first question is for you. Let's find out a little bit about the statistics of infertility, as I've mentioned earlier. How is the statistics like in Malaysia?
We're looking at infertility rates of around 15%
15%
of the population, yeah, that have experienced fertility issues.
Right.
Yeah.
And is that considered a considerable amount? Is it increasing by year? Is it something that we should be concerned about, doctor?
That's average worldwide now.
Okay.
But you probably see that it may start to increase over time, especially with aging populations and a more interest to try and increase the productivity in terms of population gain.
So the fact that it is increasing year by year, I think it's also important to know why, the causes of that. But we'll go into that a little bit later. Since the topic is on IVF, doctor, I'm sure a lot of us have heard about it. But what really is IVF? If you can shed some light, what is IVF? How is the process like?
So essentially, in vitro fertilization means getting gametes from the male and from the female and fertilizing it in the laboratory to produce embryos, which are then implanted into the womb to produce a live pregnancy. That's the gist of it.
That's the gist of it.
Yeah.
So it's not done naturally, but the birth, of course, happens naturally, but the process before that is conceived through that method. And also infertility, I mean, couples who are infertile will opt for IVF. So I'm sure that couples that come to you, the process would be that you would have to assess their fertility rate and whether they do need IVF. How is the process like when a couple steps into your clinic?
Okay. So, yeah, assessment is very important.
Yeah.
A general assessment with a good history of the couple.
Right.
Taking into consideration especially the age of the patient, in particular the women, because as they age, the egg numbers decline, egg quality declines, and risk of abnormalities do increase. So it's a very important factor to take into consideration as well. Then is the length of time they have tried and failed to get pregnant on their own, which will also determine how fast you want to go. In younger patients, obviously, there's always a bit more time where you can perhaps advise using lesser intensive methods, like simple stimulation, intrauterine insemination, failing which you then proceed to something like IVF as the final option.
Right. Okay, final option. Okay.
But if you're an older patient in your late 30s, approaching 40 or even beyond 40, if you are seeking fertility treatment, nowadays we would recommend going straight into IVF with the other ancillary procedures to follow.
Because of the time factor.
Age as well.
Age and time. Tiffany, so I introduce you as an embryologist. Maybe many of our viewers may not know what that is. Can you explain to us your role as an embryologist?
Yes. So we handle egg and sperm, and then we perform the fertilization in the lab.
Okay.
Yes.
Okay.
So after the fertilization, we will closely monitor the embryo development, and our responsibilities includes assessing the quality of the embryos, and then we select the best embryos to be transferred back into the uterus.
Right. Now, while Dr. Harris is an IVF doctor, you're an embryologist. How important is the embryo in the IVF process?
Embryo
it's one of the main, of course, the key element. That's right.
Yeah.
So how important is, and how do people or ladies out there, women, want to know, how do we maintain our embryos to be healthy?
Yeah, okay. In the lab, so what we control is the lab condition.
Okay.
We will check the air quality and the temperature, the humidity, to ensure that it mimics the natural environments of the embryo growth.
Yes.
Yeah, so to keep them safe and to
make sure that it's usable, right?
Yes, correct.
So that the quality of the embryo is maintained. Yes. So I think what you do is an extension, or you complement what Dr. Harris does as an IVF doctor. All right, now I mentioned that Dr. Harris is the first doctor to conduct a successful IVF process. We'll find out more about his history in the IVF field right after this break. Don't go away, stay tuned. Welcome back to Women Talk. We are here to talk about in vitro fertilization, or IVF. And we know that infertility has been a challenge or a hurdle to many couples in Malaysia. And in our country, we're very lucky that the reproductive technologies have been accessible and available for many couples in Malaysia, giving them hope to start families. So today we're here with Dr. Harris, an IVF doctor, and also Tiffany, who is an embryologist. All right. Just now I mentioned that Dr. Harris is actually the first doctor in Malaysia to successfully conduct IVF, and a baby was successfully given birth through the IVF process. We want to know, what year was that, Dr. Harris?
Okay, we started IVF in 1986.
1986.
And that resulted in the birth of the first IVF baby in 1987.
Right, so it has been 38 years, almost close to 40 years. IVF has been available in Malaysia, actually.
Yeah.
So how has the technology, we talk about the technology and innovation in reproductive medicine, how has the technology changed since 1986 up till now, doctor?
It has changed immensely, actually, because back in the day when we first started, everything was very crude in terms of the technology available, the pharmacology available in terms of the medication that we use, hormone medication. And the difficulties at that time was being able to access culture medias to be used and to access the proper drugs. And we didn't have what we call down regulation, which we use regularly today. And we didn't have freezing as an element to back you up in those days. So we found that we had to be very careful about stimulating patients to produce fewer eggs, which is resulted in fewer embryos, and to be able to transfer them at a much earlier stage than we do nowadays, on day 2 or day 3, at what we call cell stage embryos. So unfortunately, in those days, because of all these conditions and the kind of lab facilities we had, our pregnancy rates were very low. It's only about 25%. As compared to what it is now, which is close to 70%.
Now back to the 80s, if you look at the 80s and now, I think back then maybe IVF was very new to a lot of people. They had no idea what it's about. So how accepting or receptive were the society of IVF treatment?
So we depended not just our own patients, but also patients referred from our colleagues. And definitely in those days, the early days, IVF was strictly for those patients who had problems with their tubes, with blocked tubes in particular, or very bad pelvic conditions which gave them no choice but to resort to IVF. There was no other choice. So these were the groups of patients which ended up in our lab, as it were.
Right.
And it was significant that because of these issues, you find that the results remain low for the first 2-3 years.
When it comes to embryology, Tiffany, how has advancements in embryology improved the success rate of IVF treatment?
The optimized culture media and the better lab equipment
Right.
has enabled us to culture our embryos up to the blastocyst stage, which is a more advanced stage.
So a lot longer.
Yes, a lot longer, and enhancing our embryo selections.
Okay.
Yeah,
Okay.
and also the advancement in oocyte and embryo freezing also allow us to keep them and store them for future use, not only to use in one cycle, but we can freeze them and use them in future.
So the various things that we try to do to improve the possibility of good outcomes, amongst which one is sperm quality as well on the husband side. So we may sometimes give them supplements to help to improve sperm quality. And there's also issues in the lab or methods in the lab that we can do to improve sperm quality for fertilization as well.
Yeah.
And then on the women's side, of course, we want to make sure that they have the best health conditions, ideally before starting a program. For example, women who are overweight, if possible, to make them lose weight. Yeah? And if there are any health conditions which you need to tend to, ideally before they come into doing the program. So try and idealize all the various possible factors that might generally affect the outcome at the end of the day.
Okay, Dr. Haris, I will ask you later more about the age factor in women and how that affects the IVF treatment process. But before that, we are going to go for a short break. Do stay tuned and don't go away. Welcome back, everyone, to Women Talk. We are here today to talk about in vitro fertilization, or IVF. And I'm sure a lot of you have heard about it, but maybe not have gone through it, or perhaps considering to see a doctor about it. And I think one of the questions that we all have in our minds is the process painful? Is it a very painful process, doctor?
Okay, fortunately for the current time, it's actually a very, very mildly painful procedure, if you can call it pain at all. Compared to the early years, we are now in a time where we have new pharmacological drugs in very small volumes, very finely packaged in ready-packed syringes to give small doses with very fine needles. Okay. And the patients are taught to self-administer.
Right, I see.
You see?
Yeah,
so
it's always the husband maybe assisting
husbands do help
the wife, right?
For the wives who feel a bit scared to use it themselves.
Yeah.
So it's very much, if you have any experience with anyone in your family who has diabetes on an insulin pen, these pens are very similar. Okay. So being fine needles, very small volumes, actually there's hardly a pain factor really to worry about. Okay? Old days it was different. It was long needles, some deep injections.
Right.
Daily.
Okay. Yeah,
so
hearing about it is already scary. Yeah.
So now patients are very comfortable.
Right.
They do it themselves so that they save having to come to the clinic every day. After 6 days, they come in and do a scan. Okay? The other area that may be uncomfortable is when they have to do their scanning.
Okay.
But even that is not such an issue.
Yeah.
And the last bit is when they have to do the egg collection. So because it's done vaginally, but with anesthesia for a short spell of 10-15 minutes, patients are asleep, they don't feel anything. So they'll wake up maybe a dull pain in the tummy for a few hours, and then everything is done.
So it's fairly a simple process, but I think, you know, these couples have to sacrifice a lot in their journey to
I think
become
it's basically
parents.
the counseling, you know, the pre-treatment counseling, and giving the comfort as you explain to them what is going to happen.
Yeah.
Once they are aware and understand it, and you actually show them, oh, it's this needle, this size, and so on, most of them are pretty happy after that.
The psychological impact, I think,
Absolutely.
is very important
Absolutely,
throughout this journey.
Good counseling is very important.
That will help with the
Yes.
physical
Yes.
treatments that's involved. So talking about cutting-edge technology, Tiffany, what are the cutting-edge techniques that you use in your lab to enhance embryo development?
So in Al Haya, we have a piezo ICSI,
Okay.
which we use a very gentle way of injecting the sperm into the eggs
Okay.
and minimize the damage to the eggs and having a very high fertilization rate. Besides that, we have next generation sequencing, which we can do pre-implantation genetic testing, and we can check the genetic abnormalities of the embryos and reducing the risk of genetic disorder. We also have this special incubator that is integrated with the camera that takes pictures at a regular intervals, and we can actually
Monitor better, right?
in uninterrupted culture condition, and also we will have more detailed insight of the embryos.
Okay, and that'll be useful data for you, right?
Correct.
So not only you have to be gentle to the patients, to the mothers who are going to give birth, but also to the embryos itself. It's very important to care for these embryos very, very carefully. Doctor, let's talk about the success rate of IVF. We mentioned about the age factor earlier. So we know that biologically, women who want to give birth after 35, they're considered to be old mothers, so it's a bit riskier after the age of 35. What about when it comes to IVF? How does age play a part in this, in the success rate?
Yeah. Well, age it is important, especially closer to 40 and beyond.
Yeah.
When definitely egg numbers and egg quality play an important part.
Okay.
But having said that, given the kind of conditions and of the management we have clinically and in the laboratory, we can still achieve a pregnancy rate of around 66% or more in patients between 35 to 39.
Okay.
And the patients beyond 40 at about 55%.
Okay. All right.
This
Fairly
includes all
considerable amount.
patients across the whole spectrum of whether we do freezing or non-freezing or PGT or non-PGT. So it is, and this is a reflection actually of the methodology we have, both on the clinical side and on the laboratory side, which altogether comes together to give us these kind of results.
It's the ecosystem, or you have to collaborate.
The whole process.
Yes. Okay, doctor, what is ovarian hyperstimulation syndrome, or OHSS, and how is that managed?
Okay, so OHSS is a condition which is actually very dangerous if it's not well managed.
Okay.
What it means is that during the stimulation process, some patients hyperstimulate. That means they suddenly produce more than the expected number of follicles, and therefore more than the expected number of eggs. And if that is uncontrolled, they can go into serious cardiovascular collapse and effects of that nature. But thankfully, nowadays, we understand the condition better.
Okay.
And we are able to control the condition better. Pre-pickup, if we know there are going to be a lot of eggs, one thing we do is we collect the eggs, freeze everything. We don't implant it in that same cycle.
Okay.
Because if you do and they get pregnant, that would be terrible.
Yeah.
Secondly, for those patients who do hyperstimulate, we also have now the pharmacology and management techniques to manage the condition, to prevent it from escalating. So within the first few days of having done the egg collection, you'll see that the symptoms all subside, and patients will actually do very well at the end.
Okay, so this is one of the risks involved in IVF treatment?
It is one of the risks, but it's
Yeah.
much better managed now because we understand the whole.
Okay, that's good news. That's good news. Tiffany, what are the ethical considerations when it comes to embryo selection and genetic testing?
So we treat the embryos equally with our utmost respect. So we only do the embryo selection to help patients to reduce the time and increase the chances of getting pregnancy. Also, for genetic testing, we can avoid serious genetic conditions in babies, and hoping that the patient will get a healthy baby.
Right. One more question to both our guests before we wrap up. I know there's a lot of hopeful couples out there watching us who yearn to become parents and may be facing some obstacles in the process. So maybe a few words of encouragement or tips from you, Dr. Harris, and also Tiffany, very, very briefly before we wrap up. Dr. Harris, you first.
Well, I think awareness is very, very important in this day and age. A lot of people are aware, but that shouldn't stop you from coming for advice whenever, whatever stage of your marriage or relationship. It's always good to come early so that we can assess you and tell you, okay, you're good, and you're young, you still got time. Or you're young, but you do have a problem which needs treatment before trying to get there. So these are important things to establish early on, rather than waiting 5, 6, 7, 8 years before you finally turn up and find that you have had perhaps more serious problem than you expected.
Some infertility problem is very simple to be solved. So it's just be brave and come to the clinic.
You only will know when you see an expert
get
or
a
a doctor.
doctor's advice.
Thank you very much to our guests, Dr. Haris Hamza and also Tiffany T, for shedding some light about IVF. Now, to all couples out there who aspire to be parents, no matter what kind of challenges that you need to go through, don't give up in order to achieve that goal of becoming parents, of raising those little ones, because it will be rewarding. So no matter how the baby is conceived, whether naturally or through IVF, what's important is that the baby is happy and healthy. So to all viewers, don't forget to check us out on our Instagram, which is Women Talk TV3. Send some love on our social media. And don't forget to tune in next week on Women Talk. We'll see you then.